Hey, how's it going, guys? Dr. Dave.
Dr. John.
And we're excited to discuss with you guys today the top 4 causes of why people have low back pain. So in seeing thousands of patients between the two of us for our clinical experience, we can say pretty confidently that there's 4 underlying reasons, and it could be one of them, it could be multiple of them, why patients typically will come in experiencing low back pain.
Right.
So what would those 4 reasons be?
The first and the most simple would be muscular imbalance. And what does that mean? Is there's 2 different types of muscle groups, one called an antagonist and one called a protagonist. They work against each other to move muscles and bones in specific ways. And essentially when you have a muscular imbalance, one side of the body or one of those 2 muscle groups is overpowering, is stronger or weaker, or too tight or too loose in comparative analysis.
So in the low back, one of the most common muscle imbalances that occurs is actually going to be a big group of muscles that attaches to the side of our low back bones that runs down and attaches to your leg, letting you lift your leg. It's called your hip flexors.
Iliopsoas muscle.
And so typically what will end up happening is one side will be over tight, and then the other side of that muscle group is going to be weaker,
right,
in comparison to the opposing side. And what this will do is pre-stress your hips, so it causes one hip to start pulling higher over time.
And then, the other aspect of that is it literally pulls your spine down into the side. And so I'll do this here with patients where I have their hands go above their heads, and one arm will be significantly shorter than the other because that body is getting pulled down to the side and they can't reach up as high. So that's one of the ways we look and address
and
that
for this one, for muscle groups, this is one of the largest muscle groups in your body. So typically this is the one where we'll have patients tell us it's still tight, it's still tight, it's still tight. And it seems like it takes forever to balance the muscle groups out. And that's why it becomes very important for doing the home recommendations and not just relying simply on the chiropractic work here, or even the massage therapy work for the deep tissue muscle release on that.
Yep.
So that'd be one of them. Is there any other common muscle group you've noticed imbalances for in low back?
The 2 Ps. So the psoas muscle and then your piriformis muscle.
So this is the back of the spine. Piriformis muscle would be located roughly where?
So it runs from about right in here down across the bottom. And if you guys have heard of sciatica, a lot of patients come in and say, hey, I have sciatica.
I got a pain in my butt.
And what it does is shoot a pain right down the leg. But piriformis syndrome is actually something that mimics sciatica and isn't true form where you're compressing the disc. And what it is just simply that muscle is so tight across the bottom that it is pushing down on that nerve and fires it up down through the leg. The way that you know that this isn't true sciatica is it stops at the knee.
Right?
Yeah.
And it is, in fact, the sciatic nerve that gets pinched by that muscle.
Yep.
So when that muscle is over tight right there, your sciatic nerve is a big bundle of nerves that travels right underneath of that muscle.
Right.
For a small percent of the population, it actually goes through the muscle. And that's when it's really, really tough. But for a majority of us, that sheet-like muscle sitting right there, and your sciatic nerve travels right underneath of it. So if that muscle is very, very tight, it just pinches that sciatic nerve, and like Dr. John's saying, gives you that sciatic type pain, but typically doesn't go all the way down your leg.
Right.
So usually one piriformis muscle ends up being over tight, and then the other one again a little bit weaker, and then what that does is affect more so the tailbone.
Right.
That's problem number 1, is large muscle imbalances. What would problem number 2 be?
Disc compression.
The what?
The intervertebral discs, which give space in between the bone, and I actually have right here a larger version.
So this clear thing on here would be red.
This nice red guy here. But what ends up happening is if we have the correct amount of pressure in the back on these little joints where we're supposed to put pressure in our spine,
AKA
when we have
you
the curve,
the right curve in
right,
the low back,
then you can put pressure down on this disc, and that disc is made to be there to give space between the bones so that these nerves can flow freely. right?
So it acts as a shock absorber.
Yes, and what ends up happening is we take pressure off the back, you put pressure on the front, and it slips right out. And if you've heard of that disc herniation, disc bulge, protruding disc, I'm sure you guys have all heard that, but that's how it occurs. And so when we have that disc compression and it puts pressure down on that nerve, it'll do one of two things typically. The first is irritation, sending signals up to the brain and saying, hey, 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 something is wrong, right? And then the other is clamping it down, not letting any communication flow. So you get like numbness or tingling as one of those big issues.
So the disc itself, when it does get pinched, when it gets compressed, the underlying problem usually for that is going to be structure. So we started to allude to it, but just to kind of bring this point home, the curve that you're supposed to have in your low back is important, because if you have that curve in your low back, it takes a lot of the stress-bearing load off of that disc. But when it straightens out over time and you get bad structure when it's left for a long period of time is what
leads to that
disc.
disc compression.
Cool.
And then over time, it actually becomes a smaller little space as well, which will cause degeneration and arthritis within that joint.
So this disc, when it compresses, it's about 88% water. And when it compresses over time, it dehydrates. You lose some of the water content in it, and that's what makes it appear thinner or smaller on the x-ray, which is the number one reason why, if you're getting adjusted at a chiropractic clinic, you're not getting adjusted, you have family that are dealing with low back pain, one of the best things you can do is lumbar or low back mobility cushion warm-up exercises, because what that actually does is bring a nice pumping motion to the low back on that disc, which is the very, very thing that it needs in order to actually rehydrate the disc and fill it with water.
All right, and you guys will hear us pound this in over and over again.
Did you wobble? Did you wobble?
Wobble correctly.
Did you wobble?
Wobble correctly.
Wobble correctly.
Did you wobble?
Wobble correctly, and making sure that you're drinking water. Because as you get these adjustments, the water comes from somewhere, right? Which is your body. And if you are not hydrated, you come in, you get an adjustment, oftentimes you'll get a headache, feeling like you have been dehydrated, right? Because the discs actually steal water from you.
That's right. And it's typically the stiffest and more painful first thing in the morning, because when we go to sleep at night, our body will pull water from the discs in your spine to use for healing and other metabolic processes while you're sleeping. So the best time for most of us to actually do that low back pumping warm-up exercise is first thing in the morning. So those would be the first two things. The first one is going to be the muscle imbalances. Second one was the disc.
Yep.
Or structure. Right?
Correct. And then the third is also based off of structure, which is joint compression.
So in the back of our spine, each of these spinal joints have a bone that rests on the one below and above it. And that's what's meant to take on most of our weight, not the disc. So a common issue that we can have is, for instance, up here, easier to see for the visual, you can have rotation. So these bones twist, and when they twist, it places more weight on one side than on the other, and then creates an inflammatory joint response.
Yep.
Right? That would be one example of it, but that's specifically what we're talking about is going to be the back joints, correct?
Correct. And then the other aspect is typically what we want to see is a nice and straight spine, right? Oftentimes, we'll switch. We'll see curves that happen called scoliosis over 15 degrees. Before that, it's just a lateral curvature. And what we end up seeing is in the back, we end up putting way too much pressure on one side versus the other. And this is a big form and cause of degeneration, because a continued pressure on one side opposed to nice, beautiful, uniform pressure obviously is going to create a degenerative process.
So it's one of those things where, like everything else in life, balance is so important. And when it comes to spinal alignment, balance is absolutely crucial. So imbalance, when the spine's out of alignment, if there's rotation, which we would call torque component, or laterality, a side bend of the spine, like Dr. John's talking about with scoliosis, both of those are underlying biomechanical issues that cause improper or uneven joint loading.
Right.
And joint problems are the number one cause of what?
Low back pain and being out of work is another one.
Number one reason why people go out of work is the number one disability in America right now,
Lowback.
osteoarthritis. So joint issues that go unresolved for a long enough period of time actually cause degeneration and osteoarthritis. Reason number 4.
So reason number 4 is nerve compression. Right? And we say it all the time, we're nervous system doctors. We look at how your brain is communicating with your body.
Does that mean I'm supposed to be nervous when I get adjusted?
Not at all. In fact, you should be extremely calm because your nerves are going to function correctly.
So when you're talking about nerve compression, you're talking about the good old classic pinched nerve?
Yep. And so a lot of people who have that sciatic, they know that it shoots pain right down the back of your right back through the back of your leg, and eventually can either cause numbness or tingling.
So typically this will happen with a bulged or herniated disc, right?
Right.
And then there's other reasons that can cause it, like the scoliosis, where you can actually have a pulling or a tug on the nerve on one side.
Yep.
Right, because the space gets closed off on one side and then the nerve gets stretched on the other. But the number one cause would be disc bulge, where that disc has become brittle enough over time, it got dehydrated, it lost nutrients, and then there's a weak spot on there and it bulges outward and puts direct pinch pressure on the nerve. So pinched nerve is real, it does happen, and it's extremely painful. So those would be the top 4 things. Number 1 was muscle imbalances. Number 2 was
disc compression.
Number 3 was joint pressure or joint issues.
And then the last.
Not that kind of joint.
And the last is.
And number 4 is a nerve pinch. So these are the top 4 reasons why most of our patients will end up coming in dealing with low back pain, experiencing it for underlying problems. So if you think somebody you know that's dealing with low back pain could benefit from a proper evaluation where we're checking for all 4 of these things, be sure to let us know at the front desk.
Bye, guys.